Well, it's great to be here. Thank you very, very much for coming to join us, Dr. Topol. This is really an honor. Your book, Creative Destruction of Medicine, and The Patient Will See You Now, has really, I think, started a conversation that's redefining our profession. And
Well,
so
that's very kind of you, Brian.
it's
Or Dr. V, I should
yeah,
say.
that's my Twitter handle. It's not all been roses, of course. You know, I think as technology advances, a lot of things are changing for physicians, right? Technology has taken away a lot of what we used to do with our eyes, our ears, and our hands, and patients are now more empowered. And Vinod Khosla has suggested that, I guess, some 80% of doctors, as he's suggesting, might be out of a job in a few years.
Right, he kind of, I think, backpedaled a bit from that. Where
Yeah,
he
yeah.
basically started with that, and then he said 80% of what they do now will change.
Okay.
But in effect,
But it's fun to talk about, though. So,
Oh,
yeah,
I think that what most physicians have not accepted
right.
and are unwilling to accept, I mean, there are some that,
Yeah.
that see this, the handwriting on the wall, but we're talking about the most drastic changes in the history of the profession.
Right.
Because it is an information era, and what used to be electronic health records is going to be a joke, because we're talking about data that will transcend that exponentially, more,
Right.
generated by patients who were not capable of generating any data before. So this is a different look, and it's very uncomfortable for doctors.
And I guess this issue of sort of redefinition is the way I like to think about it. You know, this discomfort with being replaced. I always like to tell doctors that we're going to be completely redefined. I mean, how do you see that redefinition happening? I mean, obviously we're not going away. I mean, do you think we're really going away? Or
Well, no, I don't think we're going away at all. I actually
Yeah.
think, though, is a willingness to be morphed, or as you say, redefined, to
Right.
putting more energy into a different matter. So diagnostics and monitoring functions for most routine things, straightforward things, are going to be done by patients.
Right.
And they're going to be done with as good or better accuracy than we have today. But that human contact touch factor, that face-to-face interaction,
Right.
to deal with the treatments and the imparting the wisdom and experience and guidance, that's going to become the real doctoring of the future. So
Right.
it used to be, of course, Osler and diagnosis.
Right.
I'm thinking it's treatment. And with that treatment is empathy and communication and tight connection. It may not always be physical either, face-to-face. It'd be face-to-face virtual. And it'll be data exchange virtual. And a lot of doctors are not, they still think telemedicine is a farce.
Right.
And that has to be an adjustment there, because as it turns out, it's a lot more economical to see patients virtually.
Our frame of reference is really kind of still stuck in the analog age. I think we still envision patients as seen in a room, sitting on a piece of butcher paper, with this one role, and docs have a very hard time seeing it otherwise.
Yeah, the roll of butcher paper?
Well,
or the roll of,
that too, but the idea that we can use a mobile phone to communicate, or telehealth to communicate.
Yes.
And
no, I think this requires rebooting from the average 60 minutes waiting in the reception area, and then you have these assistants that are taking the vital signs. You don't need an assistant to do the vital signs. The patient can do it themselves.
Right.
And not only that, we're not talking about this one-off vital signs. We're saying, oh, by the way, here's my vital signs for the last month, every heartbeat.
Right.
All not raw data, but all processed. So this whole look is so different, and these icons that we have, the office buildings for doctors and high maintenance, high costs, and hospitals, they're all going to be challenged as to what is their real value as we have new means to deliver care in highly efficient manner.
There's some realities, though, that come with all this data that you're talking about, right? I remember at Medicine X, an e-patient stood up on the stage and she showed a graph and a pile of data, and she said she brought it to her doctor, and the doctor dismissed it, and everybody booed. And the reality is that we're just not trained to deal with this. I mean,
No.
Even with me, as progressive as I like to think I am, when a patient brings all this data, it's hard to make sense of it. So obviously there need to be some changes in the way we we have our workflows, the way we're trained, right?
Oh, I totally agree. I mean, today when, you know, a person brings in their sequence or their genomic data or lots of other kinds of data, I mean, we have not processed that's useful for either the patient or the doctor. Right. But that's going to quickly change. You can see your way through that. That's just an analytic story that's just kind of getting in higher gear right now. But it's the willingness to accept change, which has not exactly characterized the medical community over the years.
Absolutely.
No less, as you're bringing up, that we're also talking about challenges at a bad time. Challenges when reimbursement's on the decline, when there's a meaningful use, all these pressures that have come to bear, and this isn't an easy time to think of the biggest change ever.
Right. So when we think about preparing doctors for this change, let's talk a little bit about medical education. I mean, in Creative Destruction of Medicine and in The Patient Will See You Now, you paint a very different future of a doctor-patient relationship. And obviously, we really need to turn over the way we're training doctors. I mean, where do you think that should start? It's a huge challenge that, as someone in higher medical education thinks about. I mean, what are your thoughts on that?
Well, I actually think if we, in our medical schools, took initiative, it could really invigorate, excite the curriculum.
Right.
Because it would bring in all the pieces that we don't have today, that you know where this is headed. I mean, you know that digital devices, bioinformatics or medical informatics, telemedicine, the dealing with, you know, the sources of information, whether they're sensors, all these things are critical.
Right. You talked, I heard you talk at one point about young engineers working for Pandora and these other tech companies and innovating for these other verticals. You know, I've always thought, I see these young medical students, even at Baylor, but shouldn't these guys be innovating and making apps and building things and making things, and shouldn't they be participants in all this change that's happening?
Absolutely. You know, you'd like to see that we can enlighten them as to the impact they can have of improving healthcare for their fellow man. So I think there is a real way to zoom forward here, catalyze this, if we are able to bring in that talent pool.
If you were on an admissions committee and you were forced to kind of shape the profile of the doctor we want to bring into medical school to function 30 years from now, what would be the qualities of a young physician that you would look for from an admissions perspective?
Well, you know, I think the actual interpersonal capabilities are going to become much more dominant than ever. So, like, instead of being able to score on an MCAT test, you know, that's just a search, you know, on your device or your prosthetic brain. But the ability to really connect with your fellow person, to have this noble ability to care for them, I think is going to become even more emphasized. That's what's the paradox. You think, oh, we're digital, depersonalized. No, I think it's just the opposite. So the idea of being able to take the smartest people that could answer the questions right on the MCAT test, I think over time we're going to realize that that's not going to make the best doctor of the future.
Right. Brian Christian, who he's written about artificial intelligence and Turing tests and everything else, and he suggested, I think, that machines will actually prove to us what it is to be human. So all those things that technology is replacing are leaving us, the remainder is going to be that human element or human contact.
Well, you're really, that's a central concept. I'm so glad you mentioned it, because we are humbled by machines. We need to be even more humbled. That is, their ability to process information that is, you know, we're just terabytes, exabytes about people. We can't do that stuff. We can't read, as a supercomputer, hundreds of millions of pages of the medical literature in 2 seconds. So our willingness to be humbled, but then shift our energy, our priority of the real connect to our patients and to our, you know, our species.
Yeah.
And so I don't see it as the whole race of against machines. No, I see it as
rage
why
against the
don't-
machine. Yeah.
Yeah, why don't we leverage that
Right.
capability that we don't have? Our brains and our personalities and our character provide complementary aspects.
Yeah, absolutely. So, it used to be that a doctor went to medical school, and in 2 years you learned everything you needed to know, right? And those days are long since over. We've got this crisis of knowledge in medicine. How's that going to work? Are we going to move from like memorizing what we need to kind of accessing what we
Well, I
need
mean,
now, or how do you think?
I just think about it's kind of. I used to spend I don't know how many hours on rounds in the coronary care unit every day when I was attending, spending all this time teaching the second heart sound, splitting, and these other sounds that nobody. I don't even know if they heard this stuff and they knew what I was talking about or what.
They didn't.
No, couldn't record it. We couldn't. Anyway, I started realizing, wow, this is such a different type of medicine we're talking about.
Right.
And so I think that we're not at all ready for this. And the problem is, in most medical schools, it's not the students, it's the faculty.
Yeah.
And the resistance to, there's so few physicians who have realized, particularly those who are the real master educators, that, we can do far better in doing a physical exam with modern technology.
Right.
But there's this tradition and this blind irreverence.
Yeah, we're obsessed with tradition, aren't we, in medicine? It's like our biggest.
It blows me away.
Right.
Yeah.
Speaking of institutions, you've been very publicly critical of some traditional institutions like the AMA. And these are institutions, of course, that sort of represented physicians during the analog age, right? Do you see these all sort of decaying, or do you see a role for organized medicine in the digital age, or what?
Well, there's a few things about the AMA. I'm a member, so I can't be that far against them. I do that in almost as a symbolic way.
Right.
I think JAMA is a great journal, but my problem with the AMA really is indexed to their lobbying against people getting access to their genomic data. They went after 23andMe and the likes of it. And I don't think that's right. They basically were very self-serving, saying that it has to be a doctor or a genetic counselor, knowing there's such a limited number of genetic counselors. They're forcing doctors to be the mediator of genetic data, and doctors don't have the ground today.
They're just unprepared for this.
So that was the thing that really got us into a collision course. But when I did the book research for Patient Will See I was studying for the first time ever, so where did this paternalism come from?
Right.
Where did it come from that doctors own the medical record and hospitals? See, why? You pay for it, it's your body, why don't you own it? So I had to understand this. So I went back, all the way to Imhotep and Hippocrates, who, of course, we all think Hippocrates was a phenom, but actually Hippocrates is the one that,
as you described, right?
He was the one that fostered, conceal everything from the patient. Could hurt them if you give them information. Conceal. Well, then you start with the code of medical ethics from the AMA. Right. And you say, oh my gosh, basically it was a self-congratulatory orgy.
Right.
It was unbelievable.
That's right from your book, right?
Yeah, it's amazing. Anyway, it's gotten better. They got rid of some of the stuff about how noble we are and how the all-knowing stuff, but it really fostered, it kept this paternalism alive. It's still alive today.
But the AMA, doesn't it represent this vertically integrated hierarchy in medicine that has traditionally, promoted this sort of paternalism?
Yes, I do think that, we basically have within medicine lots of trade guilds. And each of these professional societies that basically cater to their constituents to make sure they get reimbursed properly and that kind of stuff. We got to get over that. We got to go to this new medicine where we're not protecting interests, but protecting the patients.
Yeah. You're pretty active on Twitter.
Yes.
We're seeing lots and lots of docs coming out into what I call the public space.
Well, you fostered that.
Yes. I've been involved pretty heavily myself, and it's changed me quite a bit. How do you see this changing the culture of medicine and physicians, or how has it changed you?
Well, it changed me in a pretty drastic way, because I used to go through all these websites searching. I'm an information junkie. And I'd say, where's all the good juice? I want to know what it is today. And now it's so much easier. just follow people on Twitter, and I'm going to find out a lot of really important stuff quickly, much earlier than I would otherwise, and stuff that I might never see. So I got an army of people doing that, and then I try to reciprocate by putting out whatever I know that's interesting or worthwhile. So I find this remarkable tool for keeping up with information that's relevant to care of patients and to what's going on, advances in medicine.
You're one of the most critical individuals in what I call my human signal. Those are the people I follow on Twitter, and they bring me all this stuff like you. What's your workflow as a physician? Do you access a fixed number of publications and then share them, or is it really coming from other people through social networks?
Well, it's kind of a combination of that.
Yeah.
I basically, the top tier journals, I mean, I know when they're coming out, and basically what to look at and things that are interesting. I can't cover everything. Right. And then there's lots of other ways that information flows, and I rely a lot on others to find that. And so I think, and of course now there's all these news aggregators like Pulse and Flipbook and Flipboard and Zeit and whatnot. So those are helpful as well. But what I find it's interesting, I like to read what the consumers read, the newspapers, particularly the ones that are really good, and see what they're more and more sophisticated about what they're transmitting to the public. Right. And in fact, a lot of times they make it much simpler to understand. Why don't doctors and scientists do the same thing? Yeah, exactly. I think we do a very poor job of training doctors to communicate and translate information for public consumption. Yeah, I even learned through tweeting that you can make it simpler. I used to try to put data in and all this stuff. Basically, just give us the bottom line and make it simple. And if people want to, really get into the details, then let them do that. But when you get to 140 characters, it actually trains you to make messages simpler. And in fact, why use 140? Why not you use just 20 or 40? People will read those more than they will a full tweet, and that's not a lot of stuff. Right. Twitter is, I guess, what we call a constrained media, right? You have to kind of get your message across in that brief little period. And I think this is actually a new kind of literacy for doctors, right? Learning how to communicate in microstyle and microform. But I still think it's single-digit % of physicians who are on Twitter. Yeah, 10%, 11%. Something like that, and it's really too bad. I think they're missing out, and it's the kind of thing where you can use it as you like. If you don't want to go there for a week, fine. If you want to go there a few times a day, that's okay too. Or if you want to follow just 10 people or 10 infectious disease doctors, you can do that. Well, if you find a person has Twitteria and you don't want to follow them, you just that's right. Don't follow them. I have that sometimes, don't I? Yeah. Well, I think we get excited, and and then one of the things that's a problem is when you do these tweet chats or whatever, Twitter chat, and you get all this, oh gosh, this person's just too much here. No, I know, I know. I think, and some doctors, when they train other physicians, they try to portray tweet chats as sort of the way it's done, when for a lot of us, I'm not a huge tweet chat fan. No. I mean, I participate to help people out who are promoting books and this sort of thing, but. Right. I want to ask you a little bit, just a question. You have a new grandson, Julian, right? Yes. And it's probably been interesting watching him interface with the healthcare system. If you were to go ahead and look at your great-grandson, what do you think a trip to the pediatrician is going to be like for him? How do you think it's going to be different? Wow, that's a great question. Julian's going to be 1 later this month. Wow, really? So he's come along, and he's really into books and iPads. But no, I think the answer, though, is we will not, kids that go to the pediatrician today, it will be relatively uncommon as it is. I mean, yes, to see a specialist because they may have, some serious problem. That's a different matter. But for the routine stuff, ear infections, we've already kind of got a whole new way. And most common things that you go to a pediatrician for will be done remotely, mostly by parents with cloud and computing assistance. But you will go to the pediatrician for anything that's serious to get treatment, because this is not do-it-yourself treatment. This is do-it-yourself diagnostics, and not for all things. I mean, you have cancer, a child is not going to be doing it themselves. Right. They may, but infections, and you don't have to even go to a great-grandson, grandchild, we're talking about this generation now, they will be diagnosing their infections,
Right.
viral, bacterial, all through their smartphone, like that. Not,
Right.
not days later when they're just, really in bad shape, but immediately. So the ability to diagnose any infection, which is obviously a big issue in kids, and then know whether you need an antibiotic, which antibiotic, that it's a virus, that's a big deal. That's going to change. I think a lot of pediatrics will be redone, how our routine stuff.
At Brigham and Women's Hospital and Boston Children's, they're starting experimental sequencing of normal newborns, and it's interesting that a lot of parents, a fair number of parents, want to opt out of it. It's this idea that I really, ignorance is bliss. I'd rather not know what's going on.
Well, we had the same thing with, not wanting to have ultrasound.
Is that
during
right?
The pregnancy. We had the same
I don't
thing
remember that.
we had the same thing. Yeah, I know, I'm an old,
Yeah.
old guy. But we had the same thing with, I don't want to know the sex, and now
Yeah.
we have reveal parties. And I mean, it takes a while, but it turns out, which is one of the most striking things that not a lot of people know, is that last year, 800,000 pregnant women had their fetus sequenced between 8 and 12 weeks.
How many?
800,000.
Holy
Which is
Toledo.
20% of the 4 million live births in the United States.
Wow.
Now, they only got read out whether there was Downs or other major
Yeah.
chromosomal abnormalities, but that could easily be changed. So we're not even talking about newborn sequencing. We're already into fetal sequencing, and most parents who are part of that don't even know what's happening.
Right.
And that's the most quickly adopted diagnostic test in the history of medicine, one like that. And it's going to be projected to be a couple of million, 50% of all live birth pregnancies in the US over the next couple of years.
Wow. Well, this is really the most, I always say this is really the most exciting time to be in medicine. I was trained in the analog age, and now a spectator to this digital transition, and it's really been remarkable to see the transition, and it's been wonderful to have you as someone with your experience to sort of translate all the stuff that's happening here. And
Well,
it's an honor to have you here.
well,
today with
thank you,
us.
Brian. I got one question back to you.
Okay.
Since you are there, you understand where this is going. How do you get fellow physicians on board?
You mean with public conversation or just in general?
All this stuff, the whole digital revolution of medicine.
Yeah, I think certainly with regard to public conversation and dialogue, I really think that it comes down to showing the value proposition for docs. I think that giving presentations on how amazing social media is doesn't quite cut it. You really have to prove this has value. So that's one thing I've learned in talking with other physicians, that you have to kind of demonstrate that story of how you find information and share it and filter it and all that. With regard to physicians not wanting to change, I'm not exactly sure that mid-career physicians and older are exactly going to turn the corner. This may be the sort of thing that change is going to happen one retirement at a time.
That'd take a long time.
Yeah, it'd be a long time, but I think the transition is going to happen.
Well, with the MOOC that you're doing, you only think young doctors are going to?
No, I don't think it's going to be only young doctors, but there are certain ingrained things about the way we see patients and the lens with which we view medicine, and it's hard to change that. You have to be very forward-thinking. I mean, I struggle every day with it. I'm always thinking about, I'm always coming back to this analog training that I had, and I'm constantly fighting it. And so it's kind of a struggle. So I'm not sure it's easy to change doctors and completely alter their minds. I don't know how you feel about it, but
No, I think this is a big challenge, and I think that in order for this to occur, it's going to have to come from patients largely, that this is the kind of care that they want. They want to be, those who want it are going to be much more driving things.
Right.
And up till now, doctors have been very uncomfortable with patients driving things.
Yeah.
And coming in with the list of stuff they got from the internet. Now
Right.
it's with their data that's been interpreted through computing means.
Yeah.
So it's going to take, but I don't think there's a question about where we're headed. It's just a matter of when.
It's so interesting about this generation is I think it's the first time in the history of medicine where patients are reshaping doctors.
I think you're
The
right.
patients are leading the way, and
Yeah.
it's been like I said, it's been amazing to see this transition, because I remember when patients first had access to information. And at the time, patients would show up in my office, and at the time they were far more antagonistic with me, because they had this power, right? And they wanted to kind of grapple with me. But I think as time has kind of gone by, patients have a more mature relationship with information, and they know where I fit in. And so it's been interesting to see.
And I think that you're bringing up a really central point that I've only been starting to understand more, because people confuse the internet information about what's on websites about other people, as opposed to having their own information, kind of rich, granular information about their medical self. And that's, I think, the real tipping point here, is that, you really, people too often had the diagnosis of whatever they read about.
Gotcha.
But this is now, I think, a big turn, because it's really about their own information.
Their digital definition.
Yeah, from a medical essence point of view, yeah.
Well, it's been a pleasure, Dr. Hubble. Thank you very much.
Thank you, Dr. V.
Yeah.